My name is Joseph Nenfort Gonet from Nigeria in Africa. Recently in my country, I was diagnosed to have a severe osteoarthritis of the left hip joint, which was secondary to accident. I get to know about this hospital through the liaison officer, Ms. Sabina, who told us about Yashoda hospital in India. So on that, we came into India for the surgery for a hip replacement. And on coming, we were received very well. The hospital staffs very friendly, especially the doctors, the nurses. Everybody was very friendly, was very comfortable with their treatment. And the surgery was done on me successfully. It was done 2 days ago, the hip replacement. And immediately after that, the next day, I started physiotherapy. The physiotherapy team were very good, very excellent in doing their work. And I've been recovering very well. As of today, I can walk with a walker and I feel no much pain. And I'm strong enough to be discharged to go and continue physiotherapy at home, to return after some weeks to be reviewed before completely being discharged to return back to my country, Nigeria. So I'm very happy, with their services, and all the staffs, everybody is very friendly, and I appreciate them for all that they have done.
Hello everyone, myself Dr. Kirthi Paladugu, joint replacement and arthroscopy surgeon, Yashoda Hospitals, High Tech City. Myself operated and patient, my name is Mr. Joseph, who is from Nigeria. He came to us with a bad hip on the left side, which is after the post-traumatic status. He has an arthritic changes, because of which he had a significant pain and limp. Doing a hip replacement was a day-to-day activity for us. రోజు చేసే అటువంటి సర్జరీనే. Major challenge what we had with this patient was a young lieutenant from Nigeria. He's 40 years young fellow who had an traumatic hip injury followed by arthritic hip, and 1 year back he has been diagnosed to have an dilated cardiomyopathy, which is an irreversible change in the heart, because of which he had a congestive cardiac failure, and he has been on a very high dose of diuretics the entire year, after which he has been asymptomatic. He presented to the hospital prior to be diagnosed as a dilated cardiomyopathy with an breathlessness and distress on walking. More than the pain, he had cardiac issues, and followed by that he was on high dose of diuretics. He has taken the treatment for a year and he has presented to us. Even though the patient was asymptomatic when he has come to us, he didn't have any breathlessness. He came to us only with the pain in the hip. Being very high dose on the diuretics, we had taken care that it has to be optimized with the help of the cardiac team and our anesthesia team. We optimized the dose of the diuretics, cut down the dose, observed him for a week. As he didn't develop any symptoms or cardiac failure, signs of cardiac failure, we proceeded with a hip replacement. We did a hip replacement, made him walk. Post-operatively, there was no significant cardiac changes, there was no significant events with the pertaining to the cardiac which we anticipated prior to the surgery, and we can give him a very smooth journey intraoperatively as well as the post-operatively. Day 2, as any other patient, he got discharged. He started walking with the walker within the hospital, and he started walking without any support for following the discharge within a week. We felt very happy, as the patient himself sent us a video sending across walking without any support, and there was a question like the physiotherapy is to be continued or not. We just suggested him to continue with the exercises, and he is ready to fly back in 15 days time. And we are very happy to give such services to a very high risk patients and in an young population, especially when it comes to the international patients with an army background and young patient and a failure. We were more scared to operate, and the patient given me an advice telling that the African or the Nigerian patients are more stronger and more comfortable being with us, and we shouldn't think twice operating on them, but it's our duty to take care of all the safety measures and give the best outcomes possible, and this is what we have done at the Yashoda Hospital's Hi-Techs here. Thank you everyone who has been involved in this case, especially the anesthesia and the cardiac team who has been supporting us throughout the case as well as the post-operative period and the pre-operative protocols to be followed. Thank you.